Hey guys, it's Dr. Justin Marcagiani here. Today we're going to be doing a live Q&A video. If you guys enjoy this great content, really smash the like button for me. Really appreciate it. Make sure you hit the subscribe as well and hit the bell so you get notifications of future content coming your way. Also, put your feedback down below, what you think. And if you have any issues going on right now with some of the information that we're talking about, please let me know. Really appreciate it and share with friends and family. All right, so I've been talking about the coronavirus the last month or so here, giving you guys updates. And again, this is a live Q&A, so we can connect a lot of other data to this video here as well. But we talked about a lot of drop in mortality in Europe and actually in this country, in the US. And we talked about how coronavirus deaths may be calculated in a way that picks up people that have it, but not necessarily died from it. And we saw some data from the Department of Health and Vital Statistics, some of the forms the doctors were filling out. But we actually had yesterday, Dr. Birx got asked this exact question during the press conference. So I'm really happy we had that question asked and answered. I'm going to put that question up here now so you guys can see it. That way it's on the record.
We've taken a very liberal approach to mortality, and I think the reporting here has been pretty straightforward over the last 5 to 6 weeks. Prior to that, when there wasn't testing in January and February, that's a very different situation and unknown. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem. Some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
That is very powerful right there. So that's my big concern. Let's just say theoretically I have COVID-19, but I'm asymptomatic, and let's say I'm working on my home during the quarantine and I fall off my roof and I get brought to the hospital and I die, but I test positive for COVID-19. What killed me? Well, according to how the statistics are being laid out, that doesn't seem to encapsulate the root cause of why people are passing. So my concern with that is that you may just see an inflated amount of people. And if we go look at the data, let me pause this here. And the lady here follows up at the end saying, isn't that a problem with coroners? Because that's not how it's picked up in other countries. So my concern is, did China factor their data that way? Did other countries factor their data that way? That's my concern, is that we may see an inflated amount. How much? It's a great question if people are thinking about it. I have an article here from the Telegraph looking in Italy. Let me find that article here, and I'll pull that up for you guys. But basically in that article, they talked about the fact that Italy had only had about 12% of people that were direct cause deaths. Let me pull it up here. Okay, so here you go. So on reevaluation by the National Institute of Health, only 12% of death certificates have shown direct causality from coronavirus, while 88% of patients have at least one pre-morbidity or even 2 or 3. And of course, the average age is up into the 70s. So that's concerning because that has to factor into the hysteria data, right? We're talking about the data. We're talking about the hysteria numbers, okay? So you can see this is yesterday's numbers right here. I can fill those out and plug them in today. It's not going to move too much. You're going to be right around that 3% realm. I think deaths are at 12 or 13 right now. So we can always kind of re-review that or re-plug that in. Let me show you how I do it. So basically how we do that is this. I just create an Excel sheet, okay, pretty simple. And if we know that the total deaths are 13,868, we just change that here. 13,868, and that changes it. We know the total amount of tests is 406,697, 406,697. So you can see that. So now we're down to 3.41%, And you can see that change there. So we're up at maybe a tiny bit, but again, the testing really hasn't touched enough people to really figure out what the worldwide load is. It's going to take time to run the statistical regression. And just so you guys can see that here, we'll just copy and paste this down below so you guys can get a sense of how those numbers are being worked out. And then if we do the real math, hysteria on the world, pretty simple as well. On the death side, we're at 86,400. And then at the caseload, we're at 142. Plug that in, so we're at 5.86%, and then we just paste this data down below. And that way you guys get the exact fresh data every single day. So I hope that makes sense. And you can see here, if we use the hysteria math when it comes to the flu, 240,000 cases confirmed via testing, 24,000 deaths, 1.2 million conducted lab confirmation, and then we're able to take the 1.2 million and then use statistical regression to get the 24 million number. That gives us 10% if we use the hysteria mortality that the media is using, right? That's 24,000 divided by 240,000, and we get the real math when we use the bigger number, which would be the 24,000 divided by 24 million. And again, we know that's real because we have CDC data on this, guys, okay? 24,000 to 63,000. We know the flu medical visits around 20 million a year and about 600,000 hospitalizations, okay? So that's really, really, really important to kind of keep in, your mind's eye on this. And I wanted to highlight a couple other things here. What are solutions? Like, what's the underlying mechanism? So having looked at all this, if I had a patient that was going to the ER, to the ICU, how would I advocate them? What would I specifically recommend to get over this hump? Well, there's an interesting article that was passed on my desk here. It was on Medium. Let me show that with you guys here, make sense of it all. I think you'll find this is very helpful. Okay, so off the bat, COVID-19 had us all fooled, but now we might finally found it's correct. So what they're basically saying is how this is being treated. They're treating it as an acute respiratory distress syndrome, which is kind of the result of pneumonia, so to speak. But they're seeing it's not really that because the ventilators aren't really helping that much. What they're seeing is they're seeing bilateral lung issues, where pneumonia tends to affect one lung, unilateral, one lung over the other. So they're seeing a bilateral issue. And what they're correlating it to is hypoxia, is not enough oxygen, which is a little bit different. And that's really fascinating. What they're finding is your red blood cells carry oxygen to your lungs and to all your organs. And your red blood cells do this with hemoglobin, and hemoglobin has iron bound to it to carry oxygen. Those are the four molecules of heme, right? And they have iron bound to it right here. Now, what's happening is the virus is attacking the hemoglobin, and you're having a release of iron, and this iron is causing a lot of oxidative stress. So it talks about the red blood cell goes to the alveoli, which are the little socks where oxygen gases are exchanged, okay? And then O2 is delivered to the blood, and then the CO2 goes back to the lungs where it's breathed out. That's kind of general physiology. Now, what they're finding is, I'm trying to just give you guys the summary so you have the right idea what's happening. What they're finding is, unlike carbon monoxide poisoning, right, where the carbon monoxide can't get breathed off, is the hemoglobin is actually getting destroyed. And then the destruction of the hemoglobin is actually releasing iron. So you can see here that little iron ion, along with millions of its friends, are being released from other hemes and floating in your body freely. Okay? And what that's doing, it's creating, right here, it's creating free radical oxidative stress. And it's the macrophages that roam around and scavenge up the free radicals. So it's stressing out the immune system by creating a lot of free radical stress. That's really, really important to note. And it's just too much iron and begins to overwhelm your lungs. This is important. And thus begins the process of pulmonary oxidative stress. So it's creating oxidative, and this leads to more damage and more inflammation. And that's why the lungs are bilateral. You're seeing it in both lungs. Pneumonia rarely ever affects both lungs. Usually it's one lung at a time kind of thing. So once your body's running out of control with your oxygen trucks, and the toxic iron starts floating around your bloodstream, other defenses kick in. All right. And so you're not going to be able to have enough oxygen, O2. Your systems are going to get overwhelmed. This is really important. So essentially, if the patient's immune system doesn't fight off the virus in time before their oxygen saturations drop too low, ventilators or no ventilators, organs start shutting down, no fuel. So this isn't an issue with the lungs being able to carry or to transmit gases back and forth. This is more of an issue where the hemoglobin that carries the oxygen is being destroyed by the virus, and then the hemoglobin releases iron, which then is like, it's like walking into a fire with a backpack full of gasoline. And then the fire knocks you down, and then the backpack full of gasoline explodes and creates more fire. So that's kind of what's happening in your body. So the approach that needs to happen has to be a little bit different to deal with the oxidative stress. Now, here's what I'm kind of formulating and putting together. Let me continue to break it down for you guys. So they're talking about potentially, I think hyperbaric oxygen chamber would be super helpful because that will increase the pressure and allow more oxygen to saturate into your body. But they're talking about same issue with the ventilator. There's not enough hyperbaric chambers available. But I think that would be helpful, given that you can increase the atmospheric pressure, and that will help. But it says we don't have nearly enough of those chambers, so that makes sense, okay? Now they're talking about potentially blood transfusions with people that have normal hemoglobin levels. That way you get fresh blood, and that fresh blood has fresh levels of hemoglobin that can now transmit and or carry oxygen in the body. So that's another potential option. I'm putting out there too is that we should find out who's asymptomatic and figure out the antibodies. Are they carrying antibodies? So if they're no longer carrying the virus load, which after 2 to 3 weeks, the virus is gone, now you have the antibodies, okay? And so now you can give that blood back with antibodies to actually go after the infection better. So I would submit that having IV blood transfusion with someone that has antibodies is even better. Now, you could go in there and spin off the plasma and grab the antibodies in isolation and do that too. You may be better off doing the whole blood because if you need the hemoglobin and the antibodies, why don't we do it in one whack? Does that make sense? I hope it does. So I'm trying to walk you guys kind of my thinking and my rationale with the physiology here. So let me keep on rolling with you guys. So we talk about doing a blood transfusion. I think that would be helpful. Also, they talked about the core point being treating patients with iron ions stripped from the hemoglobin with the ventilator intubation is futile because you can get the oxygen into your system, but if the hemoglobin's not there to carry it, you're going to be hypoxic. You're not going to have enough oxygen to be able to carry to the body. So it talks about the root cause of the illness is not addressed. Now, hydroxychloroquine may be something that it helps because it can go in there and it can prevent and kill the virus and prevent the hemoglobin from being destroyed. So that's a really good idea. We'll talk about some of the articles on that. The zinc component is very, very, very important because basically the hydroxychloroquine, we'll talk about it here again, is going to help you carry zinc into the cell. So chloroquine right here enhances zinc uptake in a concentration-dependent manner. And then it talks about this enhancement was attenuated. A high affinity of metal binding compound indicates that the specificity of the zinc uptake. So basically what it's trying to do is it's helping more zinc get into the cell. And the zinc is going to have some benefits. It's going to help with, right here, leading to neutrophil extracellular trap. So that's going to help with humoral immunity. It's going to help with the immune system as well. And it plays a role mainly in elevating inflammatory response as well as damage to the host tissue. So it's going to help play a role killing the infections, and it's going to modulate the pro-inflammatory response. So it's going to prevent the excess damage created by your own body's immune response by modulating it. So it's going to tamp it down so you don't have any excess cytokine storm. So zinc plays an important role, and how hydroxychloroquine helps, it's going to help get it into the cell better. Remember, hydroxychloroquine is used for malaria. What's malaria? It's a bloodborne parasite. So it's going to help decrease RNA and or DNA replication by inhibiting folate, and it's also going to help zinc get into the cell. And so we have to just remember zinc is going to be a really easy thing to add in. It's a common nutrient people are deficient in, so we have to remember that. All right, and let me go back here. So we talk about hydroxychloroquine in malaria. We talked about how it works. Part of how it works, it's going to help stop malaria from getting its hand on hemoglobin and gobbling it up. Seems to do the same thing with COVID-19, right? We just talked about that. And then also, if we keep on going down here, all right, this is really important. So if you go to the hospital and you are put on a ventilator, what should you do? This is excellent. We talked about in my podcast on Monday, a ER ICU doc talking about this, that how the ventilators aren't helpful. But the problem is he didn't give any specific recommendations on what to do regarding settings. So what they talk about here is keep them on O2. So keep O2 going. So up the nose, pure O2. Max it out if you have to. Do it at low, and then if you have to go on a ventilator, do it at the lowest pressure possible, but max out the O2. We don't want to tear up their lungs with max PEEP, which is kind of the oxygenation and the pressure. You're doing more harm to the patient and you're treating the wrong disease. So there's a difference here. So now what they're talking about is you do the chloroquine, the Z-Pak, right, and the zinc. The only reason why you wouldn't do the Z-Pak is if you have heart issues. Talk to your doctor before following any of my recommendations, okay? You have a doctor for a reason. Review it with them. Less virus, less hemoglobin loss, and less iron damage. So what can we do on top of that? We could do blood transfusions. We could do antibody treatment with people that have already had the virus, no longer active, and then we can do blood transfusion with the antibodies in there, or we can spin the antibodies out and get the platelets extracted. Now, what about oxidative stress? They don't talk about it down here. They talk about the antibodies. I mentioned that, right? They talk about giving them plasma with antibodies already in bad shape. That will help. And now they talk about, okay, so a couple things here about China, not trusting them. We get that already. Let me see if I can find this one more thing here that they may have mentioned in regards to vitamin C. I want to see if I can hit that. Because the oxidative stress is going to require more antioxidants now. And so the thing that I would recommend if you're in the hospital, if you can't do oral vitamin C, high quality vitamin C with bioflavonoids or buffered vitamin C is going to be ideal. Let's see, did they mention it in here? We want to do, they're not mentioning it. Okay, good. So this is just me interjecting. All right, so let me pull this off screen. So, all right, we have oxidative stress, okay? We have extra iron. We need extra antioxidants to deal with the oxidation. What's oxidation? When you have oxidation, you're losing electrons, okay? Think of cutting an avocado or cutting an apple open on the table. What happens? It starts to brown. That's real-world oxidation. That's happening in your body. Now, when you have oxidation, you have free radical damage occurring. That damages the DNA. And it creates stress on the body. So if you were to cut an avocado or an apple open and then you squeeze a green apple or squeeze a lemon over it, right? What happens? The vitamin C actually will prevent the oxidation from happening. You won't have that apple turn brown. So how does that apply to your body? You're not going to see that browning inside of your body because your body has its natural antioxidant reserves, but it will damage the DNA and it will create stress and inflammation. So if we have iron issues being released from the hemoglobin being destroyed from the virus, we'd want to do IV vitamin C if we're in the hospital, IV vitamin C. I'd also recommend IV glutathione. And if we can throw a Myers cocktail in there, which is basically a multivitamin, multi-mineral kind of in an IV form, that'd be even better. But if we were to do two things, IV vitamin C, IV glutathione, we would really restrict a lot of the carbohydrate in the ICU just because, or in the hospital in general, because we know that high levels of insulin will affect our macrophages and monocytes from being able to gobble up the virus. And so we'd use extra antioxidants. Now, if you're not sick and you want to do preventative stuff, we already talked about vitamin C, taking that orally to bowel tolerance and backing off. We already talked about doing NAC, or if you want to do a high-quality liposomal glutathione, that's great too. You don't have to go and revert to IV sources of these nutrients right away, but if you get into a hospital setting, you may want to be doing that as well. You may want to look at the blood transfusion. You may want to talk to your doctor or talk to family about what you would suggest in tweaking the vent settings, right? We talked about the hypoxia and how the high pressure, no good. Drop the pressure, increase oxygen through the nose and as well on the vent. So I'm just trying to give you guys some things to think about. I mean, the infection is real. I just think it's maybe a little bit overstated in people dying from it or with it. Those are two different things, okay? Two different things. So I'll put that out there for you guys. Hope you guys enjoy it. And just there's a different mechanism to look at here, different mechanism. So I think the hydroxychloroquine and the azithromycin are going to be huge. The zinc is the missing component. So if you guys have access to any zinc lozenges, 20 or 30 milligrams a day of high quality zinc is going to be great. You're going to get it in mushrooms, pumpkin seeds. You're going to get it in your high quality animal products. You're going to get it in seafood. Those are going to be your best places to get good zinc. That's a really easy thing you can do off the bat. All right, let me go hit some questions for you guys. Jackie writes in, I want to say I'm more worried about the economy collapsing than the virus. It's scary. Yeah, I'm more concerned right now about the economy collapsing. I know and see a lot of people that have their life's work and the businesses gone, and that's really scary. Could stiff muscles be due to the rigor mortis in a living person? Well, all rigor mortis means it's just Latin for like basically stiff muscles, right? So anytime you have inflammation in your body, cells become really sticky and they lose pliability. So get the inflammation down, and the cause of that could be a lot of different things. It could be too much exercise. It could be a poor diet. It could be not enough nutrients. It could be a lot of inflammatory foods. I smell a rat. If somebody falls off the stairs, they die from COVID-19. It's possible, right? I mean, eventually most of us are going to get this virus, and most 90% are going to be asymptomatic, meaning you won't even know you got it. So if you get in a car accident and pass, God forbid, and you're tested for COVID, that could be a death statistic for COVID, which this doesn't feel real scientific to me. And how do we... I mean, you think the whole world could kind of get together on the classification of this so we could have good statistics that are comparable, right? Compare apples to apples. Would you be able to tell the best form of zinc and the proper dosage for both kids and adults? So, I mean, typically for a kid dose of zinc, I would say anywhere between 10 to 20 milligrams supplementally is fine. You could do a zinc aspartate, a zinc picolinate, a zinc bisglycinate are all good sources. A sublingual zinc lozenge, I think, is fine. It's cost effective. I already mentioned some of the foods for zinc. Vitamin A is going to be cod liver oil or beef liver or any kind of, egg yolks are going to be awesome for vitamin A. So make sure you're getting those sources. I think zinc's a really easy one. So maybe 1 or 2 zinc lozenges per day for a child would be okay. Usually those are about 8 milligrams a whack. So something like that, maybe an adult 3 or 4. And it's really good for sore throats too. Let me keep on rolling here. Sounds like you're doing mental gymnastics just to justify your stance for many reasons. The flu is not comparable to this coronavirus. I disagree. So number one, I think that's one, totally nonsense. Number two, let me show you the stats, guys. We already talked about all-cause mortality. So let me go show you why that is a total fallacy. So let's go look at mortality rates for the 1918 flu. Okay, here's the mortality rate for the 1918 flu. Okay, here's average. This is influenza pneumonia. And look at the jump. Okay, this is quite visible for mortality. Okay, there we go. Pretty obvious. Now let's go look at today. U.S. weeks, U.S. all deaths weekly from the CDC. Look, we have a drop in deaths. Look at this. We have a drop in pneumonia. So this does not take a rocket scientist to see that something is going on here. We have a drop in deaths here, or drop in pneumonia deaths here. We have a drop in all deaths weekly. And then let's go back to previous example for 1919. What happened? Something doesn't square. Doesn't take a rocket scientist to see it. Okay, here in Ontario, if you have symptoms of COVID-19, you're added to the case number count without ever being tested. You're told you're isolated for 2 weeks and the numbers are being manipulated. Yeah, they could be. We talked about why. We talked about what's happening in Italy. Let's go back to the Italy article again. What's happening in Italy? Where's the Italy article? I'll pull it back up here for you guys. Let's see here. Let me find it for you guys. Got so much stuff open here. There it is. Right here. On reevaluation by the National Institute of Health, only 12% of death certificates show a direct causality from the coronavirus. There you go. So that's exactly what I'm talking about. Let's keep rolling. A friend was literally dying of type 2 diabetes complications, but because of the death is listed as COVID because he tested positive. I don't trust the numbers. Yep, I agree. We talked about that. Good points. Really good points. Is it possible to have PCOS? I have never skipped menstrual cycles in my life, before, during, after going off birth control pill. I always had a consistent period, but I have bad acne 22. We'll keep that to a separate conversation. Try to keep it more to corona right now. Johnny Smith writes in, everybody that goes to the hospital, they're saying they have COVID-19. There's something weird about that. Dr. J, should we be supplementing with zinc just in case? I totally think that's a good way to do it. I mean, if you're eating really good zinc-rich foods, fine, you may be okay and you're healthy. I'm taking an additional 20, 30 milligrams of zinc a day. I think that's fine. Is cayenne pepper good for oxygenating the body? It will help with vitamin A. Can I take zinc and vitamin C supplements? Yes, you can. Yes, you can. Mike writes in, thanks for the coverage. I like how you put it in context, so thankful. Should a zinc supplement be taken with or without food? I think taking it with food is always a little bit better, but if you're doing a lozenge, the absorption should be pretty good. But worst case scenario, I think taking it with food is always safe. And again, if we look at the numbers, guys, flu 2016, 2017 killed 69,000 people. So we'll see if we even come close to that. I don't think we will. But if we do, it's going to come back to we got to look at the overall deaths. If we see this drop in death like we talk about here, this doesn't make sense. Okay? And again, guess what? This isn't just a localized thing. Okay? Let's go look at Europe. Okay, this is Europe. This isn't just a U.S. phenomenon. Age 15 to 64, we actually have a drop in death. The red line is the mean line for the average amount of death per that time of year. We're dropped 15 to 64. We're dropped 5 to 14. We're up a little bit at the age 65 plus, which we know that's the most predisposed group, but each of the last 3 years had a higher level. Okay, and then look at all ages, a little bit of a blip here. That's coronavirus right there, but look at each of the last 3 years. So something doesn't add up. I'm just going by what the data says. So if you guys have issues, let me know some data that you guys want to share that will refute that. So zinc, glutathione, NAC are your top 3 recommendations for increasing immune system. Yeah, I think that's good. You could throw vitamin A, C, and D in there. And again, glutathione or NAC could be interchangeable. I'm taking D3 at 8,000, zinc 50 milligrams, selenium 100, vitamin C 2 to 3 grams a day. Yeah, it's okay. You may want to calibrate vitamin C a little higher. Let's keep on rolling. I can only source ascorbic acid, not buffered ascorbate. So if you can do buffered ascorbate, it's better. You may be able to tolerate it better, and it may cause less bowel distress. So it just depends on how you're tolerating it. What do you think about 5G radiation? That's about to get bad. I think there may be an issue there, but the jury's kind of out. We'll see. I've always talked about look at professional athletes. People say professional athletes are healthier. Yeah, but it's not about their health. It's about the highest level of performance. And if this is such a stressor, it's going to tweak their performance. You may see more injuries, a lot of weird things with athletes just getting hurt easier, those kind of things. So I'll be curious to see. And of course, athletes are so keen on any shift in their performance or their recovery that I think you're going to start seeing or hearing more about it from athletes, or looking at additional ways to shield EMF, to neutralize it, whatever way possible. I think you're going to see additional means to be able to handle that. Does that make sense? I hope it does. Okay, excellent. All right, let me keep on rolling, guys. Is food-grade hydrogen peroxide good for giving the body extra oxygen? Yeah, you could do that. I'm okay with that. Drinking my own urine for antibodies. I mean, there is something to be said for that. I don't know how much other toxins are going to be in the urine that may negate it or put more stress on the body, but I have heard that the antibodies would be dumped out in the urine. I think it's much better if you have the antibodies to see if you can get them drawn out and then siphon off the platelets, or just give the whole blood if you can. So I wouldn't recommend drinking the urine. Would you recommend supplementing with iron based off of the needs for increasing oxygen in the blood? Not if you're a guy, because remember, that may increase the oxidative damage from the iron already being released. So if you're a guy and you don't have a natural menstrual cycle, that probably wouldn't be the best thing. So I think you need to really up the antioxidant reserves and just do your best to get on something that prevents the destruction of the red blood cells / hemoglobin. So of course, all the antioxidants and the immune modulating things I mentioned. And then if we need, we have the additional medications, which you all should be talking to your doctor about, because some people, the azithromycin is contraindicated with heart issues. So you really want to confirm and talk to them about it. Resistant starch can repopulate gut bacteria. We can do it on keto. You potentially could do some resistant starch as long as you don't get bloating or gassy. Some unripened plantain and banana flour is fine. How accurate are the antibody tests? Well, they're still in progress, so they'll be out hopefully next month. So next month for the antibody testing. That'd be the best thing. Let me just switch over to Facebook, give you guys some love over there. Got a bunch of questions. Hey, Kathy, hope you're doing well. Hey, Steve, has the present death rate exceeded flu for 2016, 17, and 18? No, not even close. We're at 14 or 13 right now for coronavirus, and with flu, right now we're at 24, 25. This season, average for flu is 36, and 2016, 2017 flu was 69,000. But again, the question is, if I were to have flu and have a heart attack, and I died of a heart attack, would they count me as flu? Would they count me as a flu death, right? That's the question. I don't think flu is counted that way from a mortality standpoint. So now the question is, if we're going to compare the exact criteria for COVID-19 to flu, how many more thousand people are going to die of flu, right? Because you got to have the same criteria for both. You can't have this, criteria over here and then change it for flu. So that's the problem. It makes it really hard to compare apples to apples. What about using Plaquenil, Z-Pak, and zinc? Yep, we talked about that, and mega doses of C. That is, I think, a great option. But again, they're not going to recommend doing the Plaquenil, which is the hydroxychloroquine, and the Z-Pak until you actually have it or test positive. Some doctors are recommending protocols preventative, but I would recommend all the nutrients preventative. So treatment, if critical, remove iron by, you'd remove iron by essentially doing a transfusion by adding more hemoglobin to the mix, which could fuel the issue, right? While at the same time, you'd add in extra antioxidants to deal with the oxidative stress of the iron. I think that's how you would do it. Because the problem is, right, you can't decrease the iron because if you do bloodletting, for instance, you're going to also decrease the little amount of hemoglobin that's there. And that's going to make carrying oxygen even worse, right? So it's like you have this iron. Normally you say, okay, if I have high levels of iron, let's give blood, let's do a therapeutic phlebotomy. But if I do that, I'm also going to lower my hemoglobin, which is already low because the virus is destroying it. Does that make sense? So you kind of have a double-edged sword. That's why I think adding more fresh hemoglobin in would probably be the better option, but you have to deal with the oxidative stress from the high levels of iron. So if you guys or family and friends are in this position, make sure you talk about this with your doctor, see if it's an option. Let me keep on rolling. Zinc, vitamin C, you need to be taken different times because vitamin C can inhibit zinc. I'm not too worried about that, but you can always just take zinc with food. I mean, when you consume food, vitamin C and zinc and all these other minerals and amino acids all come together anyway. Okay, excellent. What supplements are you taking to prevent coronavirus? I'm taking my Immunosupreme, which has astragalus in there, andrographis, echinacea, some medicinal mushrooms, some monolaurin. I take vitamin C to tolerance. I take medicinal mushrooms, especially reishi. I'm taking NAC 2 grams a day and a little bit of glutathione and D. Okay, excellent. I think I answered all the questions, guys. Let me see if there's anything else here. Bruce writes in, the Rockefeller Institute's research on the presence of antibodies in the urine and their effectiveness against fighting the virus, and polio urine is a derivative of your blood. Yeah, the question isn't about the antibodies in the urine. The question is how much other toxins are in the urine that could put stress on your body and your immune response. So the question is, how do you get the antibodies without the additional toxins? I think the blood way would probably be the cleaner way to do it. But again, if you were desperate and no one was giving you that option, then sure. But I would look at getting it in the blood first. What can be the cause of extremely dry skin? So in general, fix the diet, good healthy fats. Make sure you're digesting those fats, and then make sure you fix the gut infection. So if you have candida or bacterial overgrowth, which you mentioned, that could be an issue too. How much and how often do I drink? I may consume like 1 or 2 glasses of like a dry prosecco or cava or like kind of a champagne, usually one day on the weekend. I typically will do activated charcoal and glutathione too. Okay, excellent. What would you do if you had very low iron and very low hemoglobin? Well, I mean, I'm a guy, so I'm in a different position. because women tend to have that problem more because they lose blood because of menstruation. So if you're a woman and you're of cycling age, you have to figure out, is it coming from estrogen dominance that's causing you to lose blood in your monthly cycle? Is it causing because you're a vegan or vegetarian, you're not consuming enough high quality animal products, especially red meat? Or is there a significant malabsorption issue where you're eating red meat, you're eating good things, you don't have excessive menstruation, right? More than 4 tampons a day for 2 or 3 days, and you're still having low iron. Well, then you got to look at the gut. There could be a parasite infection, or just maybe you have inflammation in the gut, like an irritable bowel disease that's preventing the absorption. So it just depends why. You got to look at the root cause. Okay. Oh, excellent. My wife just chimed in. Tell them what supplements you're giving to our 2.5-year-old. So my 2.5-year-old is getting liposomal vitamin C, about 1 to 2 grams a day. He's getting 2 tablespoons of cod liver oil a day. He is getting a elderberry syrup. That's a low sugar elderberry syrup. He is also getting a little bit of probiotics, and I think those are the big things I'm giving him. There's one other formula called Biocidin that I'm giving him that has a little other immune modulating compounds in there. And I think in the elderberry syrup is a little bit of astragalus and beta-1,3-glucan, which is the active constituents in medicinal mushrooms. And of course, his diet is very paleo-esque. Zinc deficiency is also tied to iron deficiency. Yes, it is. Yep. So 5G stuff, same kind of thing I just said earlier. If you guys missed it, go back and look at that response. Yeah, Sue, so if you're menopausal, then I think you got to look at the gut stuff, right? Got to look at the gut stuff. Got to make sure your diet. I know you're a patient, Sue. I just forget your exact case, but I would look at the diet, digestion, gut function part of the fence. All right, guys, hope that makes sense. Hope that answered all your questions, kind of giving you kind of the most recent data on what's happening. If you guys enjoyed it, put your comments down below. If you're struggling with your health or any immune challenges, let me know down below. Love to help. Make sure you subscribe. Hit that like button. And if you want to work with me deeper, click down below. You'll see a link to work with me. I see patients all over the world. All right, guys, you have a phenomenal day. Stay healthy. Take care. Bye.